we need one another to be a stronger whole. When I think about scientists need clinicians, clinicians need scientists, we all need educators. The advocates get this word out to the street and actually move things forward in a more global way.
It's the first treatment available to patients that slows down this advanced degeneration. It allows patients to maintain their vision for longer, and what's interesting is that it works better the longer we use it in patients.
I've been involved in advocacy sort of late throughout my career. You know, the work that we do in family planning is advocacy in and of itself, I think. Providing care that is sometimes controversial. But, you know, when the Dobbs decision happened, it was really important to be more out there and having a voice where otherwise there might be a vacuum.
And when we think of all the social drivers that are likely to influence obesity, food insecurity is pretty, rises to the top because it's about the food you eat and how you're nourished. So, interestingly, I think maybe ironically, people might think that if you don't have enough food, you should have a lower body weight, but it turns out that the opposite is true pretty consistently across ages. So, it's unclear exactly why that is, and Chris and I are going to try and unravel that association a little bit with some shared clinical trial work and basic science work.
I'm a cardiologist who takes care of patients with genetic disorders, and I see patients who haven't been diagnosed. My own children had undiagnosed genetic disorders. So this is really one of the reasons I want to do this. So we're going to take those genetics data and we're actually going to return results.
When those things that structure our lives get interrupted, then that affects our health. And so occupational therapy works with people to keep them able to participate in what they need to do and want to do.
I think there's nothing that really prepares you for, we were just talking about putting in your first order and just clicking submit. And I think my first order was putting in a Foley catheter, and I hesitated. I was like, is this the right move? And it definitely was the right move, but it's been an adventure and I'm learning every day and meeting new people, so it's been amazing.
I've wanted to be a doctor for as long as I can remember, and when I got into college and started doing some shadowing and seeing how much room there was left for us to figure out scientifically what new treatments we can come up with for patients, I realized I was never going to be someone who was satisfied not being able to say, I don't know the answer exactly to what's going on with you, but I'm working on it at the bench side.
And then I remembered my experiences in emergency medicine and realized that that was the perfect place to combine my interest in procedures, my interest in humanism and the social aspects of medicine into one location.
I am very interested in a lot of things. I've done a lot of things in my career. I think the clinical trial aspect has been really important for me, mostly because I'm very interested in diversity and making sure that we have diverse clinical trials, and I think that kind of links with the community engaged work that I've been doing as well, and just really making sure that the research we do is representative of the people that are going to take part in the results of the research, or that we hope will take part in the results of the research.
When I came here in 2006, I was probably one of the few people, or I was a fellow or few faculty that were doing research in Hispanic and Latino populations. But I have to say I was blessed by having a mentor. I'm going to name her Dr. Svetki,
Oh, yes.
who was very open to actually explore an area of research that was outside her expertise.